Hi, my name is Amin Gill and I am the Multicultural Counselor here at the College of Idaho. I was asked to share a short video about mental health awareness for Project Launch, a wonderful organization that's collaborating with Relay for Life here at the College of Idaho. Today we're going to talk about COVID-19 stress in young children and what we can do to help them cope with this stress. The information in this video is based on an article from NC State Extension. Just like adults, children are experiencing a lot of stress right now. They're going through transition, they're going through adjustments, and there's just many changes going on. And again, with young children, they may not be able to fully understand the entire scope of it. So what does stress in young children look like? Stress in preschool age children can look like, of course, irritable mood, sleeping issues, and uncontrollable crying. For elementary age school children, this can look like aggression, constant questioning, and of course, challenging, complaining, new behaviors not present before, trouble concentrating, nightmares, and of course, physical symptoms, tummy aches, headaches. It's basically stress manifesting into physical symptoms because they don't know how to let it out. Remember, children don't always know how to voice or even understand what stress is, so it's important to pay attention to the changes that you're seeing. Coping strategies parents can use with their children can look like, again, pay attention to the changes. You know what their usual behavior looks like, and so when you're noticing, hey, something's a little off, they didn't do this before, pay attention to that. Be positive. Focus on the behaviors that they're doing that are good and encourage more of that. We call it positive reinforcement, right? So focus on the things that you want to see them keep doing. So really praise them. Those moments you see them doing good, just be like, hey, yes, I see you. I notice you. And they're going to know then, hey, mom and dad or guardian is paying attention to me. Acknowledge their feelings. Let them know it's okay to feel angry, sad, confused, or whatever they're feeling in the moment. Provide them with a feelings chart. This is something you can just Google online and get and print and go through the different feelings and boxes with them and let them circle, color in the ones that they feel. This can help them name their feelings. And also it develops something we call emotional intelligence. It helps them recognize and understand their emotions better. Avoid shaming statements. Look, I know, parents, these are some tough times and our patience can really be tested. And it's okay if you need to take that 5-minute break just to kind of step outside and just collect yourself before saying statements like, hey, you're really bad right now. Saying something like that, a shaming statement, can really affect the self-esteem of children. It also they can internalize that, where they don't feel like just because I'm doing this, mom and dad said that I'm bad, they may just start feeling like, hey, I'm just a bad kid. So we want to kind of step back and avoid saying those shame statements. And remember, parents, I know we're human, okay? It's okay that if we're not having a great day or even a good day, maybe we're just all out having a bad day and mistakes happen. And this is a really good learning opportunity. Sit down with your kids at that moment, maybe that you said something that you wish you can take back, and apologize for it explain to them, hey, mom and dad were feeling like this, and this came out, and that's not what I meant. This is a great opportunity, like I said, a learning opportunity, because you're going to be exemplifying what they can do. So it's going to teach them basically next time that they do something that's not so great, or, just letting them name their emotions or apologize for it. It's going to teach them, because they're going to remember this instance where you were in the same situation and you were able to sit with them and be like, hey, open up that dialogue about feelings. I wasn't feeling so great. I said this and I'm sorry about that. Ask for help. Like I said, parents, I know this is a very challenging time. Reach out to friends, your parents, their grandparents, loved ones, anyone that you can think of that can help you in that moment. Set up phone times, or different, use the internet to set up video conferencing, just so your kid can sit down, just so your children can sit down with another adult and you can get a little bit of a breather, and they can talk to grandma and granddad, and maybe they could read them a story. Maybe your kids are even going to feel more comfortable just talking about the different feelings that they're feeling inside with somebody else. So remember, just have that social time, reach out to different people who can help you. Maybe one day there's a mom or dad that, they can chat with, and then the next time you can chat with their kids, or just different things, within the family, if that's how, you feel. So there's different avenues you can learn that help you get some respite, help the children get some social time, and maybe even open up to different people. Give children the opportunity to talk. I always say sometimes it's better to use natural moments where this comes up. This can be bath time or before we go to sleep time. Give children the opportunity, carve out some time where you just ask them, hey, how are you feeling today? I know we're going through a lot of changes right now, and how do you feel about that right now? What's going on inside? Give them natural moments to express themselves. One example that another parent actually suggested, which I thought it was great, is sometimes children wake up at nighttime and they're asking for maybe a snack, or they're saying, hey, I'm having trouble sleeping. And these may be their natural times or natural ways for them to express that they're ready to talk. And so it's so easy for parents to be like, oh, here's that snack, and quickly go to bed, or that's okay, we're going to try to keep, we're going to try to go to sleep now, and just steer them to the bedroom again. But maybe during these times, give them that little snack and sit down with them and just let them talk. They may be ready to talk in that moment, and where you just put your listening ears on, and they're going to be able to share all sorts of information, because that's when they're ready to talk. Another strategy parents can help children express themselves is through play, using imagination, what we call play therapy. Just times for them to be able to express themselves in a way that they know how, which of course is play. Examples can be through storytelling, theater play, acting out their emotions, maybe using puppets. Anything that's make-believe and pretend play. Pay specific attention during these times, parents. This could be a way that they're expressing themselves or what's going on inside of them, in a way that they're not able to do just sitting in front of you where you ask questions. So it's really important during these times to keep your ears open, keep your eyes open, because that's how they may be able to tell you what's going on inside of them. These are some of the strategies that I hope can help during this very stressful time. Again, this time of transition and many changes taking place. I know with young children that the Project Launch is catering to right now, that it can be very difficult to understand what's going on inside of them, because there is a lot going inside of children right now during this COVID, crisis. There is a lot of stress that they're feeling. It's just hard for parents. I can understand that, for them to understand how to open up that dialogue with such young children. And some of the strategies that I talked about today hopefully can help you open up that dialogue. Remember, you're doing a great job. Kids are so resilient, but it is important to give them opportunities to talk about what's going on inside of them. And sometimes it could just look different in the ways that we do it, but definitely we can pick up on those cues. So I hope this video helped you during this time, and thank you so much. Take care.